The tonsils are two small, oval-shaped masses of tissue situated at the back of your throat, one on each side. Despite their modest size, tonsils play a significant role in your body's defense system. As part of the lymphatic system, they act as the first line of immune defense, filtering out bacteria and viruses that enter through your mouth and nose. Their surface is covered with crypts and folds, tiny crevices that trap incoming pathogens, allowing immune cells within the tonsils to recognize and fight off potential infections. This function is especially crucial in childhood, when the immune system is still developing and constantly exposed to new germs. However, tonsils can sometimes become a source of recurrent trouble. Some people experience frequent or chronic infections of the tonsils, known as tonsillitis. Others may develop enlarged tonsils that block normal breathing, especially during sleep, leading to a condition called obstructive sleep apnea. When tonsils become persistently infected, swollen, or cause other health problems, doctors may recommend a surgical procedure known as a tonsillectomy, the complete or partial removal of tonsil tissue. A tonsillectomy is a common procedure, particularly among children, but it's also performed in adults. The goal of this surgery is to alleviate symptoms caused by problematic tonsils. In most cases, once the tonsils are removed, the issues they caused, such as recurring infections, sore throats, or breathing difficulties, are resolved. However, there are rare instances where tonsil tissue appears to grow back after removal, leading to confusion and concern for patients and their families. To understand why tonsils might regrow after surgery, it helps to know a bit more about their anatomy and the surgical process. Tonsils are not solid, uniform organs. Instead, they are made up of lymphoid tissue, interlaced with folds, crypts, and extensions that reach into the surrounding area at the back of the throat. This intricate structure makes it challenging to ensure that every single bit of tonsil tissue is removed during surgery. During a tonsillectomy, the surgeon carefully dissects the tonsil tissue away from the underlying muscles and surrounding structures. However, this area is complex and sensitive. Important nerves and blood vessels are nearby, and excessive surgical aggression can increase the risk of complications such as severe bleeding or injury. As a result, surgeons may sometimes intentionally leave a very thin layer of tonsil tissue behind, especially if they are concerned about safety. In other cases, some tissue may remain simply because it is hidden deep within folds or obscured by inflammation or scar tissue. There are also situations where surgeons choose to perform a partial tonsillectomy, sometimes called a tonsillotomy, rather than a full removal. This approach is more common in children, particularly those with very large tonsils causing sleep apnea. By removing only a portion of the tonsil, surgeons can relieve airway obstruction while preserving some of the tonsil's immune function. Partial tonsillectomy is associated with less pain and a faster recovery, but it does mean that some tonsil tissue will intentionally remain. No matter the reason, whether by accident or design, if any viable tonsil tissue is left behind after surgery, it retains the potential to grow. Tonsil tissue is composed of active lymphoid cells, which can multiply in response to infections or immune stimulation. Over time, this residual tissue may enlarge, a process known as tonsillar regrowth. The regrown tissue may not reach the same size as the original tonsils, but in some cases it can become large enough to cause symptoms similar to those experienced before the initial surgery. So, how common is it for tonsils to grow back? After a traditional, complete tonsillectomy, where the surgeon's aim is to remove all visible tonsil tissue, regrowth is quite rare. Most people will never experience it. However, after a partial tonsillectomy, regrowth is more likely simply because some tissue is left behind on purpose. Even so, the percentage of cases where enough tissue regrows to cause symptoms is still relatively low. When tonsillar regrowth does occur, the signs can mirror those that led to the original surgery. Individuals might notice recurring sore throats or episodes of tonsillitis, despite having had their tonsils removed. Others may experience persistent difficulty swallowing, noisy breathing, or the return of snoring, especially during sleep. In some cases, a doctor examining the throat might see visible swelling or small lumps at the site where the tonsils used to be. If regrown tonsil tissue leads to significant problems, such as repeated infections or airway blockage, a second surgical procedure, called a revision tonsillectomy, may be considered. This decision is made carefully, weighing the potential benefits of removing the remaining tissue against the risks of surgery, which may be higher if scar tissue or previous complications are present. For most people, though, tonsil regrowth is not a cause for concern. It's important to remember that the vast majority of tonsillectomies are successful and permanent. If you or your child experience symptoms that suggest tonsil regrowth after surgery,
it's a good idea to consult your healthcare provider. They can perform a thorough examination and discuss the best course of action, whether that means watchful waiting, medical management, or, in rare cases, another surgical procedure. In summary, tonsils are important immune organs that sometimes require removal when they become problematic. Although complete tonsillectomy typically removes all tonsil tissue, the complex anatomy of the throat makes it possible for small amounts of tissue to remain, either accidentally or intentionally. This leftover tissue can sometimes regrow over months or years, potentially causing symptoms similar to those before surgery. However, regrowth is rare after a total tonsillectomy and more common when only part of the tonsil is removed. If symptoms of regrowth develop, medical evaluation and, if necessary, further treatment can help resolve the problem and restore comfort and health.